I was scared to death because I didn't realize at that time that just a few blocks away there is such a hospital with such a staff who can do miracle.
So a main artery supplying the right side of her brain, a major chunk of the right side of the brain was plugged up, putting that part of the brain in danger of permanent injury. So as strokes comes, it's a very severe stroke symptom that she had. If the artery remained plugged up, there is no doubt in my mind that she would have had a very major stroke. Maybe not immediately life-threatening, but certainly very disabling stroke. And here is a person who is at baseline very functional, independent, who is a neuroscientist actively involved in research. For her to lose her brain just like that and not be herself would have been a shame, of course. When she came to us, her eyes were deviated to the right side. She was ignoring the left side of her body. She was completely paralyzed on the left side. And when I say ignoring her left side, if you would show her her arm, she would not even recognize that it exists. So she had severe stroke symptoms, profound stroke symptoms. And they were all because of lack of blood supply to the brain on the right side. And that's something we were able to determine through the CAT scans that we have available in our ER. When stroke patients come to us, the standard of care is to give them a clot-busting medicine. It's called TPA. It has been around for over 17 years now. We have a lot of experience with that medicine. So when we saw there was no improvement following the TPA treatment, we decided to take her to the cath lab and do what we call mechanical thrombectomy, essentially implying use mechanical means to try to take the clot out. We go through the groin, into the carotid arteries, take a picture and see what we are dealing with. In her case, when I was in the carotid artery on the right side with our diagnostic catheter, as I injected the dye, it clearly showed that the main artery supplying the right side of the brain had a blockage in there. From there on, what we did was we took some further catheters, some more hardware up to the artery in the brain. We approximated our catheter to where the clot was, and we were able to retrieve it. Fortunately, it was a very rewarding case because the blood vessel opened right up, and Dr. Sislo, she was paralyzed on the left side, and immediately following the recanalization or reopening of the artery, while still on the angio table, she started moving the left side.
Yes, I cannot believe, especially today when doctors showed us the pictures.
Before and after.
This is really, to go into the brain with the cannula. I don't know.
A very good time being in this hospital for this difficult 4 days, but we felt here like at home, you know. This was so, the care was unbelievable. We can compare it with other hospitals and we see that this was exceptional. And our friends in Detroit said, oh, that's good that it happened in Toledo.